You've probably heard of platelet rich plasma, and that's what we're going to discuss now. Platelet rich plasma is exactly what it sounds like. It's a solution that is very rich in platelets. Where do we get it? We get it from your blood. So it's your own stuff going back into you. Now, there are some people who have certain problems that we really just can't treat well surgically or with other non-surgical methods. People have had a joint replacement but still have pain around the joint, which is sometimes soft tissue pain. Patients who have a trochanteric bursitis of the hip, a tennis elbow, an Achilles tendonitis. There are many of these diagnoses that we're not very good at treating operatively or non-operatively. But if we can just trigger a healing response to be accelerated, those people can maybe heal themselves. And about 15 years ago, some people did some pioneering work with the use of platelets to stimulate tissue healing that had just given up. And it worked. So how do we do it for instance, a tennis elbow? Well, what we do is we draw blood from you. About 2 ounces, 60 cc's typically. Though sometimes if we're treating particularly difficult problems or multiple sites, we might do what's called a double blood draw, or 120 cc's or 4 ounces of blood. We take that blood and we put it in a special container that looks like this. When counterbalanced either with another blood draw or with water, it's then put into the centrifuge, and the centrifuge then 3,600 RPMs, which is about 3,000 times the force of gravity. Once we close it and centrifuge for about 10 minutes, the centrifuge separates it such that when you pull the specimen back out, there is a serum layer on top, the red cells on the bottom, and a very small layer between those two, which is called the buffy coat. Now, in that coat is where all the nucleated cells, some of which are stem cells, but the platelets reside. Now, for a typical specimen, it would be north of 12 billion platelets in that sample. We have a way, by using syringes at the top, to eliminate the serum and then pick up almost all of those platelets in a single sample. Now we inject that into the site where the problem occurs. That can be done under ultrasound. It can be done just what's called a local peppering technique into the tender area, or it can be done under fluoroscopy if we're trying to put that into a joint cavity. Typically, people are very sore for the first few days after that injection, and candidly, sometimes the injection is fairly painful. We don't want you to use anti-inflammatories, non-steroidal anti-inflammatories, either over the counter or by prescription, for at least a week before the procedure or for 5 weeks after. That would include Aleve, aspirin, ibuprofen, Celebrex, meloxicam, or any number of other anti-inflammatories on the market. These appear to affect the way the platelets function. That's why people take aspirins to prevent blood clots that would give them a stroke or a heart attack. About a week after the procedure, most people's original pain goes away from the injection. And for most people who get a benefit, between day 17 and 21, they usually experience what we call a eureka day, where one day they get up and they can tell a difference. Unfortunately, this doesn't work for everybody. And even that eureka day may be a 10% improvement, but sometimes it's a 90% improvement. And some people get complete cures from this kind of therapy. But statistically speaking, about 80% of the people for certain diagnoses get 50% better with a single treatment. 50% of the people get at least 80% better from a single treatment. And for diagnoses that otherwise we have a very difficult time treating, that's good enough for most people. The question always comes up, but what if I'm 30 or 40% better? Well, we can do it again. There are places around that automatically recommend 3 therapies. We usually do one, and if people need another, we do another. It is actually fewer than 10% of the people that we treat. Now, why does platelet-rich plasma work? Because the platelet is the reservoir in your bloodstream of growth factors. The platelet-derived growth factor, very creatively named, was the first one discovered. But there are a large number of growth factors in there that promote healing, promote differentiation of the stem cells that are also in the blood and the local tissues, and those are called transforming growth factors, alpha and beta. Then there are colony-stimulating growth factors, which cause those then differentiated stem cells to grow into better, healing, normal tissue for the local area of involvement. I hope that answers some of your questions today.